Today's class we are going to see about neuropathology in trauma. Okay, the first thing we're going to study is about traumatic brain injury. We can write traumatic brain injury as TBI, and it can be one of the questions. It's a very common question asked in exams because it's a very important topic. Okay, so head injury. You can imagine how a person gets head injury. Okay, the common cause is accident. It could be a fall, it could be a fall from a height, it could be a fall in the bathroom, it could be an accident, two-wheeler accident without a helmet, with the helmet, a car accident, bike accident, train accident, plane crash, or a swimming pool accident. A person who's diving from the swimming pool can go and hit the head on the inside the water, the floor inside the water. So there are various reasons how a person can get head injury or traumatic brain injury. Okay, so it could also be a blow from another person. Two people are fighting, one person hits the other person. So there are different reasons for traumatic head injury and traumatic brain injury. So when a person has injury to the head, it could cause a fracture of the skull. The skull is composed of bones. So there could be a fracture of the skull. And in school in physics you would have studied about how a body which is in motion or movement cannot come to a sudden stop. Okay, there is momentum. Even in the bus, when you travel, when the driver puts a sudden brake, you don't stand straight inside the bus. When the sudden brake is put, you go forward and then you come backward. Okay, as the brake is being applied, you go forwards, and as soon as the brake is completely applied, you come backwards. Okay, the similar kind of action, mechanical force acts inside the head. So head is the box inside which the brain is present. So when a person has any accident or any fall or any blow to the head, what happens to the brain which is present inside is it moves forward and then comes backward. Okay, this kind of movement causes injury to the structures inside the head. What are the structures inside the head? In neurology in first year anatomy, you studied that the cerebral hemispheres is one of the structures, then the cerebellum, and then the brain stem. Okay, so these are the structures inside the head. So the cerebral hemispheres or the right and the left cerebrum are not fixed rigidly inside the skull, and they can keep moving. Okay, so these are the ones which can have a lot of movement when the person has an injury and or even a shake. Okay, so let us see what are the types of injuries that can happen to the brain when this kind of blow or accident happens. Lesion is nothing but damage. Okay, lesion due to movement of the brain. So when the brain moves, what are the lesions or damages? See, when there is a movement, sudden movement of the brain, the axons which are present in the brain, they get stretched and the blood vessels get torn, and the surface of the brain, it gets damaged. The skull is made of bone, and there are ridges on the bone. If you have seen the inside of a skull in the anatomy class, you would have seen that there are a lot of ridges. It's not a smooth surface. So the brain structure goes and hits against these ridges, and that can cause tears in the blood vessels and also in the brain surface. So this can lead to a lot of problems. Brain is a very sensitive structure, and it controls the whole body, the sensation of the human body, the motor or muscle function of the human body. Everything is controlled by the brain. So when a part of the brain is damaged, the whole body has impact, and the injury to the brain causes physical problems to the whole body. So let us see what kind of damage happens in the brain. The brain is covered by the meninges. So the brain and the meninges may be damaged in traumatic brain injury. Because of this, there may be contusions and lacerations. Lacerations are cuts, and contusions are uh, areas where blood gets clotted. Okay, and the common types of injuries are subdural hematoma, diffuse axonal injury, and these kind of hematomas and axonal injury. Okay, there are different types of hematomas. One is the epidural hematoma and the subdural hematoma, arachnoid matter damage. So all these things we will be studying in the course of this chapter. So when the brain gets damaged, the blood vessels which are present in the brain also get damaged. So when blood vessels get damaged, they do not supply blood supply to part of the brain. That can lead to ischemia. Ischemia is nothing but lack of blood supply. When there is lack of blood supply, it leads to lack of oxygen in the brain tissue. That is called hypoxia. Okay, hypoxia is lack of oxygen, and that is because of ischemia, which is blood does not flow. Okay, so whenever there is ischemia or break in the blood supply leading to hypoxia, the brain does not function because it does not get enough blood. If the brain does not get enough blood for a period of time, very short time, probably 4 minutes, then it leads to death, okay, of that particular area which does not get blood. So when there is a mechanical injury or trauma, okay, it causes damage or disruption in the blood flow in the brain, and it also causes increased vascular permeability. Okay, certain parts of the brain get more blood, and there can be hemorrhage, that is blood leaks from the arteries and flows to the wrong area, okay, inside the brain tissue. So this can lead to inflammation or swelling. Okay, so there are initial effects of the trauma or brain injury, and there may be secondary effects. Okay, and the secondary effects are mainly the hypoxic ischemic encephalopathy or increased intracranial pressure. Okay, you know, the blood pressure is the flow of blood in the arteries. Okay, there could be increased intracranial pressure inside the brain. See, brain is a structure which cannot expand because the head is a hard the skull is a hard structure which prevents expansion. See, if you get a fracture in your leg or hand, there is enough place for the swelling to occur, but inside the head the brain cannot swell indefinitely. There is a structure which prevents the brain from swelling over a beyond a particular level. So that causes increased intracranial pressure. So when these things can occur, it can lead to cardiorespiratory arrest also, and the person can die, and there are various other problems that can occur. So let us see what are the various lesions that can occur when there is brain injury. The first thing is the epidural hematoma, subdural hematoma, and then contusion. Okay, so there can be loss of neurological function because of the brain injury. There can be something called as concussion. Okay, where a person is in a sort of transient or a short time coma or short time loss of consciousness. Okay, that's why a lot of people you see after a head injury they get unconscious. The Glasgow coma scale, which we will be discussing later, is one of the important methods of assessing how serious the traumatic brain injury has occurred. It tells whether a person is in very deep in coma or in mild coma, and it can be used also as a prognostic method. Okay, if the Glasgow coma score is very less, it means that the person has very less chance of recovering. If the Glasgow coma scale has a high score, the chances of the person recovering could be much higher. So it could be used as a prognostic tool also. So there are various effects or complications that occur after a traumatic brain injury. Some of these effects are seizures, seizures which we have already studied in epilepsy. Seizures can occur following traumatic brain injury. There can be focal neurological deficits, that is, specific parts of the brain which get damaged, they cause specific physical problems, and there could be dementia or loss of memory. There could be persistent vegetative state, that is, a person loses the ability to function normally, and it is something like a deep coma. Sometimes it's called as brain death also. And people who have repeated trauma are at risk of Alzheimer's disease. People who are boxing, you've seen boxing on television, people who are involved in boxing have repeated blows to the head, and a lot of the boxers, as they grow older, they suffer from Alzheimer's disease or memory loss. Okay, they forget things. The reason is the repeated injuries to the brain, the trauma has caused them to have loss of memory. So let us see what are the effects of traumatic brain injury. The first thing is the skull fractures. Okay, skull fracture is common if it's a very high intensity injury, that is at a very great speed. If somebody falls just by hitting one person while boxing and things like that, they may not have skull fractures, but there are instances when people have hit each other and have had skull fractures also. But it is usually common when people fall from a bike or when they have a very high intensity accident. So the most common type of fracture is a linear fracture or a straight line fracture. Okay, fracture in a line. It is not a zigzag fracture but a linear fracture. And sometimes because of the hit on the head, there is a depressed skull fracture because the skull goes inside. Okay, and that is a depressed skull fracture. One thing you should understand is a person can have a skull fracture but they may not have brain damage. Okay, skull is the bone, the brain is inside the bone. Sometimes the skull may be fractured but the brain is not affected at all because the skull does not touch the brain. There are times when there may not be a skull fracture but the brain can hit the skull and inside of the skull and can have brain damage. So this you have to understand. So when there is a skull fracture, there can be a open area between the intracranial compartment and the air sinuses, nasal fossae, middle external ear. So when there is a communication or when there is a gap in this area, it leads to infection of the brain and meninges. Okay, infection should be prevented at all costs because infection can also cause a lot of damage to the brain. The next problem that occurs in traumatic brain head injury is epidural hematoma. See, normally there is no gap between the cranium and the epidura. Okay, so there is no epidural space at all. The dura is stuck to the skull or it is adherent to the skull. So when there is fracture of the skull, it can tear the arteries and veins. As we have already seen, the arteries and veins can get damaged, and these arteries which run between the dura and the skull, when they get ruptured or torn, what happens is they start bleeding. So when there is blood between the skull and the dura, the place where there was no gap, it fills with blood. Okay, this is the epidural hematoma. See, normally the dura is adherent or stuck to the skull, but because of injury, the arteries and veins which are present between the skull and the dura, they start bleeding, and this forms a hematoma or an epidural blood clot. In up to 2.7 to 4% of people who have traumatic brain injury have this kind of injury, and of the number of people who have epidural hematoma, 10% of them are likely to die. So cranial fractures are present in 70 to 90% of the cases who have epidural hematoma. Okay, so usually people who have fracture of the skull are likely to have epidural hematoma. And some of the symptoms in epidural hematoma are increased intracranial pressure in the epidural hematoma area with rupture of the arteries. Okay, and this can develop within hours. It may not be, I mean, it would have started immediately after the injury, but for it to be identified, usually it takes a few hours unless you go into the hospital immediately and have a scan. So clinically, the symptoms may appear a little later, and with venous bleeding, it may take even longer time. Okay, and spinal epidural hematoma can also occur as a result of trauma, and people with bleeding disorders, who are the people with bleeding disorders? People with hemophilia and diseases like that, where the blood does not clot easily. There is continuous bleeding. They may have bleeding spontaneously after a injury. Okay, hope you understood what skull fracture is, what epidural hematoma is, and how they are caused in traumatic head injury or brain injury. The next thing that we are going to study is subdural hematoma. Okay, we saw epidural hematoma. We are going to study about subdural hematoma. In 12 to 29% of severe traumatic brain injury, we can see subdural hematoma occurring, and 40 to 60% of those who have subdural hematoma are likely to die. Okay, so let us see what this subdural hematoma is all about. It occurs because of hemorrhage. Okay, there is bleeding, and in the subdural space, okay, there is subdural space in which there is bleeding, and this occurs because of the tear of the arachnoid membrane. Okay, and when the brain shakes following a injury, there is rupture of these blood vessels. Okay, or the blood vessels get broken, and that leads to bleeding. Okay, all these hematoma and contusions are caused by bleeding. And how does the bleeding occur? Because of mainly the rupture of the blood vessels. The brain has a lot of blood vessels because the brain needs a lot of oxygen supply, and the blood takes the oxygen to the brain. So when any of these blood vessels get damaged, it leads to hematoma, and a lot of them die because of the hematoma. So who are at high risk of having this acute subdural hematoma are those who have brain atrophy. Okay, they have the veins which are stretched and there is no place for the brain to move. In those people, if the brain injury occurs, it shakes and leads to high risk of rupture of these blood vessels, which results in hematoma occurring. Okay, when these hematomas occur, how does a person die? There is intracranial pressure. Okay, the bleeding occurs in the brain, and there is no place for the blood to drain. So what happens is it raises the intracranial pressure, and the brain gets compressed. The space which is occupied by the brain is compressed. So when the brain gets compressed, the brain stops functioning. Okay, so there is sudden increase in the symptoms. So when there is compression of the brain, it leads to severe symptoms. Okay, and here there is a gap between the trauma and the onset of symptoms. That is why a lot of people immediately after an accident they seem to walk normally, but within a few minutes or a few hours they start having symptoms, and some of them have serious problems and can even lose their life. Okay, so here in this picture you can see the subdural hematoma. There is a bleeding. Okay, so in small children or infants, when this subdural hematoma occurs, they may have the gray white matter differentiation in the underlying hemisphere. So the gray matter and the white matter, there is no differentiation, and this This is called as the big black brain. Usually we have gray matter in the brain, white matter in the brain, but because of the bleeding, they have no difference between the white matter and the black matter. Everything looks like blood. Okay, it's like a bloodied area. It becomes black. That is why it's called the big black brain. And usually these kind of people who have such severe brain damage, they die. They have a poor prognosis. Usually it is fatal because there is severe bleeding, so much bleeding that everything looks black, and that's why it's called the big black brain. So there are a lot of other issues as well in these people. They have apnea and they have seizures. Okay, and even if the person survives, they have a lot of atrophy. Atrophy is due to lack of blood supply and oxygen supply. It has lost its consistency. It has atrophied. Okay, like a muscle. If you see, if the muscle is atrophied, you see that the muscle is lost its muscle bulk. It's like a thread. It doesn't have the bulk. So similarly, the brain matter also seems atrophied, and there is loss of neurons, and all this is because of the changes that happen because of subdural hematoma. The next damage that occurs is the subarachnoid hemorrhage. Okay, here you can see the black part. You can see the brain which is under that, the cerebral hemispheres, and on top of that you can see a layer of blood, okay, which has become brown here. Sometimes it looks black. So this is the subarachnoid hemorrhage. So this is another frequent damage that occurs in brain injury. A lot of people suffer from subarachnoid hemorrhage. So here again, the blood which is present on the brain is from rupture of the corticomeningeal vessels, the arteries which are present. Okay, corticomeningeal vessels, it could be an artery or a vein, and this leads to hemorrhage and contusions. Okay, and this is diffuse, that is spread over a large area. It does not exert localized pressure, unlike other contusions or this thing. And here the blood is mixed with the CSF and it is diluted. The blood is diluted. But when the subarachnoid hemorrhage is huge, it increases the intracranial pressure, just like the other hemorrhages or hematomas. There is increased intracranial pressure. So what happens is it reduces the perfusion, and then there is reduced cerebral perfusion, and all this can cause hypoxic ischemic encephalopathy. Okay, and there is vascular spasm also because a lot of RBCs are released in the subarachnoid space, and all this, what happens is, because of all this, there is CSF circulation which is impaired. Okay, the cerebrospinal fluid which usually circulates is prevented from circulating, and that is one reason for hydrocephalus. You have studied about hydrocephalus, where there is increased intracranial pressure and the head of a child who suffers from this kind of problem gets swollen up. Okay, but in an adult, because the brain as a head, a skull is very strong, it cannot expand too much, and the increased intracranial pressure causes more brain damage. Okay, the next problem that occurs because of traumatic head injury is cerebral contusions. Okay, there are contusions which you can see on the cerebrum, and this is caused by coup counter coup contusions. Okay, what is this coup counter coup contusion? See, I gave an explanation of how a bus driver who puts a sudden brake, when you're traveling inside the bus, you will go forward as the driver is applying the brakes, and as soon as the brake is complete, you will go back. You would have had that sudden jerky movement when the driver applies a sudden brake. You go forward and come back. Okay, similarly, when a person has a head injury, when a sudden blow to the head occurs, or when the person falls from a bike or has a car accident, what happens is the brain which is inside the head also goes forward, hits the front part of the skull, and then goes back and hits the back part of the skull. This is why it's called coup counter coup movement. Okay, so when the brain hits the front part, there is bleeding in the front part, which leads to coup contusion, and when the back part of the brain goes and hits at the back opposite side, it's called counter coup contusion. See, I am saying front and back. Just imagine, it's not always the anterior part is not the front. If the person is standing in the opposite direction and hits, and the first blow is on the back part, that is called the coup, and the front part of the anterior surface which has the repercussion or the secondary blow, that's called counter coup. Okay, so whichever part hits the skull first, it's called the coup contusion, and the opposite side is called the counter coup contusion. So here the cerebral material are injured because of the injured because of the ridge in the skull, and that leads to the bleeding, and that leads to severe contusion formation, and a cerebral infarction can occur. Okay, this is the coup counter coup contusion. So you can see this side it's got damaged, and here there is damage. So this part would have hit the skull first, and this side would have hit second, or this side first, this side second. So it depends on which direction the person's head got suddenly stopped when it was moving at high speed, and which side got injured second. So here usually the fall to the back causes the occiput or the back of the head to hit the ground first, and then the front part hits the ground. So this is the cerebral contusion, which occurs also because of brain injury or head injury. Okay, so we have studied about various aspects of contusions and hematomas. With this we'll finish this class. The next class we will be studying about diffuse axonal injury or traumatic axonal injury, and we will also study about cerebral concussion and shaken baby syndrome, how children are abused and what kind of damage they have. Okay, thank you.